In recent years, there has been a surge in younger people being diagnosed with colon cancer, making this conversation all the more urgent during Colorectal Cancer Awareness Month. Here to shed light on this pressing issue is MUSC Program Director, Colorectal Surgeon and Associate, Dr. Colleen Donahue. Dr. Donahue, thank you for seeing us today.
Thank you for having us. Excited.
So I do need to ask you about this surge that we're seeing in younger people. What do you think is leading to this increase?
So to be completely honest, we don't know. I think the majority of research in colorectal cancer right now is going into finding out why younger patients have more of an increased incidence in colorectal cancer, whereas in all patients it's going down. So this specific subgroup is getting higher rates of colon cancer and at more advanced stages.
Okay, so they're getting diagnosed at advanced stages, these younger patients.
Typically that's what we're seeing. They're presenting and they might have already signs of spread to either the lymph nodes or other areas within the body, and they're being diagnosed as early as their 30s or even younger.
Oh my goodness. So how does it present differently in older patients versus younger?
So it can be a wide range. Some patients won't have any symptoms whatsoever. Typically, if the tumor itself gets larger, you might present with abdominal pain. The most common symptom is rectal bleeding, and a lot of people when they're young will chalk that up to being hemorrhoid disease or anal fissures, but any amount of bleeding in any patient should be worked up with a colonoscopy. It's not considered normal.
Okay, now what about changes in stool?
Yeah, so you might see caliber changes, so that means the size of it. So people will describe it as a thin pencil-like stool. Also really anything that's out of your normal. So if all of a sudden you're having changes like diarrhea or even severe constipation, if it's not normal for you, it's something that needs to be checked out.
Okay, so if someone's experiencing those symptoms, how long until we think there might be a problem?
So if you're already having any changes in symptoms, you should talk to your primary care doctor about it. There can be some simple explanations, but if it's ongoing and you know increase your fiber, you're not seeing any improvement, it certainly begs a referral to a gastroenterologist.
Okay, and now earlier you said that nationwide we're seeing a slight decrease overall. What about South Carolina?
So South Carolina, if you look at all patients altogether, there is still that slight decrease. It's about 1 to 2% in incidence in the last 5 years. But if you take the subgroup of just those young patients, so any patient less than 55 years old, we are still seeing an increase even in South Carolina.
Okay, and now we're still trying to figure out what is causing this. What are some lifestyle modifications we can make to either prevent or to treat?
Yeah, so there's the big obvious things that we all think of. So decreasing alcohol consumption, if you're a smoker, stopping smoking. There has been some ties with red meats and processed foods to colon cancer. And then the other thing that we've been showing is a high fiber diet. So a high fiber diet is actually protective of colon cancer.
Okay.
So we recommend fiber supplementation, or at least through dietary intake, about 25 grams of fiber a day.
Okay, and now with this increase in younger patients, is the screening age changing?
It has. So that's been a new thing over the last couple of years. It was 50 years old if you didn't have any family history or any high risk features. And so now it's 45. So all patients 45 years old. Now, if you have a family member that had colon cancer, that screening is going to be even younger. You're going to start at age 40. So it does matter if you have family members.
And now what are the different screening options?
Yeah. So the most common one everyone thinks of is the colonoscopy. Everyone thinks of going through the prep and drinking all that the night before. And so that is what we consider the gold standard test. The reason being is because not only do we find any polyps, which are those precancerous growths, but you can also remove them right there and then and stop cancer in its tracks.
Okay.
Not only that, but if there's a small cancer, sometimes you can treat it through the colonoscopy alone.
Oh, okay. And now if someone was maybe a little standoffish and really didn't want to get that colonoscopy, what are some other options that they have?
So there are some other screening tests that are options. One of them is Cologuard, and so that's the one that you may have seen commercials for, where you send in a stool sample, and basically they're checking the DNA and blood content in the stool. So they're taking two tests and putting them together. That you need every 3 years, and you can only do that if you're just average risk, meaning you have no family members that have had colon cancer.
Okay.
And then the other thing, if it ends up being positive, is you do need a colonoscopy anyways.
Okay. And now genetic testing is now being recommended recommended. And quickly, I want to talk about the MUSC offers free genetic testing. Can you expand on that?
Yeah, so genetic testing used to only be offered for people that were young that were diagnosed with colon cancer. Now, anyone with colon cancer is recommended to get genetic testing, which we have a new hereditary cancer center at MUSC that does that for patients. Now, outside of that, MUSC and the In Our DNA program is offering genetic testing for colon cancer and breast cancer for any patients despite any diagnosis of colon cancer. So anyone can get that testing done.
That's wonderful to hear. We will put the website where you can visit and find out more information on that. Dr. Donahue, thank you again.
Of course, thank you.
We're back after this.